How does marijuana affect people with pre-existing depression? How does marijuana affect people with pre-existing depression? This is a question that many individuals and their loved ones may wonder about. The relationship between marijuana use and depression is complex, especially for those already dealing with mental health challenges. Research indicates that while marijuana does not directly cause depression, individuals with depression may turn to marijuana as a coping mechanism. They often seek temporary relief from their negative feelings. However, heavy or frequent marijuana use can lead to increased depressive symptoms. This is particularly true for adolescents and young adults. Those who use marijuana regularly often report more severe depressive symptoms compared to those who do not. Over time, continued heavy use can hinder recovery efforts, even after receiving treatment. Studies show that individuals who continue to use marijuana frequently are more likely to remain clinically depressed. In contrast, those who stop using marijuana often experience a greater reduction in depressive symptoms. Marijuana impacts mood regulation through the endocannabinoid system, which interacts with stress and reward networks in the brain. Some animal studies suggest that compounds in marijuana, such as tetrahydrocannabinol and cannabidiol, may have antidepressant-like effects at specific doses. Yet, in real-world situations, these effects can vary widely based on individual differences like genetics and temperament. For people with depression, marijuana use might lead to short-term mood improvements. However, these benefits are often overshadowed by long-term risks. Regular use can worsen depressive symptoms and increase the risk of suicidal thoughts. In individuals with mood disorders, such as major depressive disorder or bipolar disorder, marijuana use is linked to more severe symptoms and poorer overall outcomes. From the perspective of substance abuse and addiction, marijuana use in those with pre-existing depression raises concerns. It can become a maladaptive coping mechanism. Instead of addressing the root causes of their depression, individuals may rely on marijuana to manage their symptoms. This reliance can lead to increased use and potential dependence, making recovery more challenging. For mental health professionals, it is essential to monitor marijuana use in clients with depression. Educating them about the risks of self-medication is crucial. Encouraging evidence-based treatments for depression can help support clients in reducing or stopping marijuana use. This approach can lead to better mental health outcomes and a greater chance of recovery. In summary, while marijuana may provide temporary relief for some individuals with depression, regular or heavy use is generally linked to worse depressive symptoms and poorer treatment outcomes. People with pre-existing depression should approach marijuana use with caution and seek professional help for both their mental health and substance use concerns.